So far, I have received notice that two first responders are in serious condition. I guess we knew this was going to happen. These are people who are ill because they are serving the public. We also know that some nurses at Phoebe Putney are ill. It is important that we keep these people in our prayers, that we remember that in this time of challenge, they step up, not for themselves. They don't act to protect themselves, but they act to protect others. It's difficult for me, having been in office for only 2 months, to confront this situation, because I know that we are asking our public works employees, our public safety employees, the people that work for the Albany Transit System. We have drivers who are ill. These individuals serve the community, and this is a risk that they are exposed to and that they have nobly embraced. Please, please keep these individuals in your prayers. They have embraced a life to protect and serve. And when this ordeal has passed, I trust that we will all remember the sacrifice that these individuals have made in this time of trial. I want to say I'm somewhat embarrassed. The chairman and I had a conference call with various clergy today at 11 o'clock. I assumed ministers and leaders of the faith community would complain. When can we get back to church? What are you doing? The conference call was quite the opposite. These clergy members notified us. They are praying for those who are ill. They are praying for us as community leaders. They ask, what can we do? But more than that, these clergymen have already taken the initiative. I was taken aback to learn what the faith-based community has already done, knowing that we have people who will soon be out of work and the immediate need that these people will have. I thought that Chairman Kohelas and I would be questioned about when we can get back to church. How much longer is this going to go on? But the leaders, these ministers, members of these churches asked, what can we do? And I am, as I say, somewhat embarrassed, because I remember earlier this week when members of the faith-based community were in the parking lot of Phoebe, showing their support, their appreciation to those who are on the front line every day. I can tell you again where I started. We have two first responders who are in serious condition. But we also know that those on the front line, nurses, physicians, willfully expose themselves to this virus. They are to be embraced, and I hope when this ordeal has passed, we remember that they rushed to the sound of gunfire, while the rest of us sought shelter. Please, let us come together in this time of trial, and we will all be the better for it. Thank you. May God bless you.
Thank you, Mr. Mayor. I'd like to bring up now the chairman of the Dougherty County Commission, Mr. Christopher Cohilas.
Thank you, Chief. Thank you, Mayor. As each day passes, it is not lost on me how this community continues to come together each and every day. This has been a learning process. We have watched this horrible disease infect our community, but I'm astonished by the strength that has come from within this community to battle it. I have seen our citizens go through different stages of asking questions, learning, and then executing. This disease is real. This virus is real. It has infiltrated many facets of our community, but our community has stood very strong. One of the things that I want to talk about today that I think is very important for us to stress, there are people in this community that believe that there's a stigma associated with the coronavirus. There are people that believe that they will be shunned, that they are a pariah if they admit or they seek treatment or seek diagnosis of the coronavirus. That is not true. No one did anything wrong. This is just a virus. It is a pandemic that is striking the entire world. And I think oftentimes part of the human response is to say, I must have done something wrong, or I can't admit that I need to get help. There are people in this community, there are families in this community that have walled themselves off because they're afraid of seeking the services that they need to get. We need to call those people. We need to encourage them to call the hotline. We need to encourage them to get the resources that are available to them so that they don't suffer quietly in their own homes. We do have many people that have become infected with the virus. We have taken swift and very decisive action in order to combat it, but people do need to understand and realize we do have first responders who have been there on the front lines fighting. They have it. There are professionals that have it. There are members of the court system that have it. There are members of the school system that have it. And I say all of that to say this, not one of them did anything wrong. No one that has been exposed to the virus has done anything wrong. We need to make sure that we are encouraging everyone to make use of the resources that are available to them, to make sure that they continue to do the things that we've talked about, social distancing, not going in to perform any non-essential service. If you have a non-essential business, then you just need to stay at home for right now. I have been astonished and blown away by the tremendous amount of support and cooperation that we have received from across the community. I, along with Mayor Dura, I agree with everything Mayor Dura said about our phone conference with the clergy this morning. We had a fantastic phone conference that was made available to the entire faith-based community, and their questions were not, when can we go back to church, but rather, what can we do? Our problems will continue to emerge. This is going to continue to infiltrate our community, and understand this, we are not alone. Our situation is not unique. The only thing that may be unique about it is that we are sort of at the forefront in comparison to many other cities and counties and regions around this state. How we respond to it defines who we are, and we know that as a community, we have been through 4 presidentially declared natural disasters. We have picked ourselves up by our bootstraps. We have gone back to work. We have dusted ourselves off and always been Albany strong. Thank you.
Thank you, Mr. Chairman. I think after what we've just heard from the mayor and the chairman, the seriousness of what we're dealing with here in our community and across this country, across this world we live in, the only weapon that we have now is social distancing. We should take it serious. We should take the mayor and the chairman's word serious to shelter in place and exercise social distancing. That's our weapon right now. I'd like to bring up now for some comments the Chief Medical Officer of Phoebe Putney Memorial Hospital, Dr. Stephen Kitchen, for some comments.
Thanks, Chief. And, I think the information that I'm going to share with you in my comments are absolutely going to be reflective of the comments that Mayor Duro and Chairman Kohelas has shared with you in terms of the impact of COVID-19 on our community, but more importantly, how this is going to galvanize our community in terms of what our collective response will be. Because, our experience at Phoebe Putney and our health system is certainly reflective of the information that you've heard thus far. So the update I have for you today, across our health system, we have now had 217 patients who have tested positive for COVID-19. We have a total of 255 patients who have tested negative for COVID-19. So, I think what we're seeing is that the chances of having a positive test with the screening criteria that are being used is we have roughly about 50% of individuals who are going to test positive for this virus. We still have a little bit over 1,400 people and patients for whom the test is still pending at this point. Regrettably, the number of deaths has increased from 12 to 16. Those deaths fall into two categories. Patients who had a confirmed positive test, who unfortunately have expired in one of our intensive care units, or patients who had expired who had a test that was pending, and subsequently those test results have returned. Across our hospital, as of this morning, we had a total of 126 patients at Phoebe Putney who either have a confirmed positive test or have a test that is pending. If you break down that 126, 31 of those patients test positive and 95 have a test that's still pending at this point. All three of our intensive care units at this point are all filled with COVID-19 patients. Our other inpatient medical units, we've actually expanded one of those. So again, those patients are cohorted in 3 individual nursing units at this point, and we actually expanded one of the inpatient units that we have to be able to treat a larger number of patients with COVID-19. But I want to underscore the fact that we only have 4 available beds at this point for COVID-19 patients, and like I say, we have no available ICU beds at this point. So we are at the point where we have topped out in terms of our capacity. So we have been forced to be in the position, patients who are coming into our emergency room, and particularly if they need an intensive care bed, if we don't have a bed available, we reach out to other hospitals in our region and across the state. And I will tell you, by and large, that response has been overwhelmingly positive for sister hospitals across our state being willing to accept patients from our emergency room who need an intensive care bed that we simply don't have the present capacity. And I will tell you, I think for those hospitals who push back and have refused to accept those patients, I think it runs countercurrent to what our medical mission is, and that's to serve patients in their moment of need, no matter what the circumstances are. So let me speak a little bit more about what's occurring in our intensive care units and on our general medical floors where our COVID-19 patients are. Again, I simply cannot say enough about the way that our staff, our physicians, our nurses, our respiratory therapists, and everyone who's been involved with care of these patients has worked tirelessly over the last few weeks to provide everything that they have. And I will tell you, they are tired, they are weary, they are emotionally spent, but their professional ethos always puts patient interest above their own. And I think you're seeing that certainly reflected in other community responders, first responders, that sort of thing. And they do put themselves in harm's way. And there is an image that will be forever etched in my memory, and I was thinking of that. And I think we all remember back to 9/11 and the scenes coming from the North Tower and the South Tower. I never will forget that image of first responders climbing those steps, knowing that they're putting themselves in harm's way, but they felt a higher calling and a higher purpose. So again, I can't overstate. I've never been prouder to be a part of our medical staff and our medical community, and never been prouder to be part of the Phoebe family as well. So, I will tell you, we're gaining a better understanding of the course of this illness. And that's rapidly evolving at all times. But, certainly from data that the CDC has shared, a recent article that appeared in a very, very respected medical journal called Lancet that is based on the experience in China, what we're gaining a better appreciation of, if this course of disease progresses to the point where a patient goes into respiratory failure and has to be put on a ventilator, their prognosis changes rather significantly. And so what we know is that the mortality rate goes up significantly when that occurs. So, the real question that the medical profession is asking ourselves is, what can we do? What treatments are available that might alter the course of that disease? And I think I've mentioned before, there are some treatments, some medications, although investigational, based on the limited experience we have so far, really are suggesting that they can alter the clinical course of that disease. And we're fully pursuing those. And they are currently being used for patients who have the appropriate clinical indications on our medical units and our intensive care units. And we're looking to extending those to symptomatic individuals at this point. We have also, as effective this morning, and this was at the suggestion of Scott Steiner, we have stood up a physician cabinet, and it's going to be a small group of very, very respected and seasoned clinicians who have a real vested interest in investigating whatever treatments might be available to alter the course of this disease. And so they're going to function in an advisory capacity to advise our medical staff and our leadership in terms of what can we do to truly be on the cutting edge of this. And what I will tell you is Phoebe will devote whatever resources that are available to make sure that we stay on top of this and that we can glean the best understanding of this disease and what novel therapies might be available. Thank you.
Thank you, Dr. Kitchen. I'd like to ask the Director of the Southwest Health District, Dr. Charles Ruiz, to come up for some remarks. Dr. Ruiz.
In speaking for public health services in Southwest Georgia, I'd like to say that we always aim to do what we can to take care of the public and to provide timely and compassionate services to the public. In times like this, though, we have to focus our attention on the crisis at hand. And so for that reason, across our district, we have had to look at ways that we can pull back on some of our less urgent services so that we can repurpose our staffing to a degree and have them focus more on the pandemic. So it's possible that some of our services may be postponed. An example might be a routine asymptomatic examination of some kind. We're rescheduling those sorts of things. For women, infants, and children's services, frequently known as WIC, we are now able to accomplish some of our educational services over the telephone. So people don't have to come in for every person-to-person visit. For tuberculosis treatment, we're using electronic technology in some cases. Instead of a nurse going out to meet with the patient face-to-face to administer the medication, we're using technology, video technology to do that. So we're trying to be as smart as we can and use our services and our assets the best way we can for the good of the community. I'd like to say also that we ask for your patience. We try to respond to questions and we try to meet every need as quickly as we can. Dr. Kitchen referred to the bombing of the towers years ago, and when we think about that and things like the tornadoes that we've experienced and Hurricane Michael, you know, when those things occur, we suddenly are devastated and we are challenged for days at a time. But typically, within a day or two of those kind of sudden events, things start to get a little bit better. Power is restored and goods and services start coming back online. And that's not what we're dealing with here. This started off insidiously, gradually, and has gotten worse and worse. And we don't see the top of the curve yet. So as we get more and more taxed, you may find that public health services are just a little bit slower in some regards. So please be patient for folks who are reaching out for information and guidance. We want you to do that, and we will respond as quickly as we can and with as much courtesy as we can. But with that being said, I would like to point out that we have a district website. A person can go to southwestgeorgiapublichealth.org. We have a lot of information posted there on the pandemic. We have a Facebook page as well. but we're happy to receive telephone calls and help people in any way that we can. I want to say a word about our numbers. Our numbers as far as positive cases and the deaths are now listed on our website. They're listed by county, and this is by county of residence. So you can go there and easily find those numbers. Also, we'd like to talk again about the need for sick people to stay at home. In many cases, people have developed COVID-19 infections because they attended a social event and because someone else attended that event that had the infection. That's not true in every case, but there are a significant number of those kinds of cases. So we want to plead with you, if you are sick and you know that you're sick, please stay at home. Don't spread this virus around. If you are sick and I would say this, if you're symptomatic, you need to have a consultation with a medical professional. We prefer that would start with a phone call or an online communication. We plead with you, don't just go to an emergency room or to a doctor's office unannounced. A phone call or some kind of communication needs to take place before that visit takes place, and for a couple of good reasons. The facility needs to know that you're coming so that they can prepare. If you're symptomatic, they do not want you to be sitting in a waiting room and exposing others to potential transmission of an infection. So they will be typically waiting on you, and if you're symptomatic, they will put a mask on you as soon as you enter the building and take you to some place where it's kind of set aside. Another reason is if you call in advance and talk with the provider, you may learn that you don't need a face-to-face visit after all. But one thing for sure, we do not want our emergency rooms to be overrun. We don't want people coming in with the virus without us knowing about it in advance. So please call in advance. The exception of that is if you have a dire emergency. For people that are having serious problems breathing, then yes, that is an emergency and you may well need emergency medical services. Please call for those accordingly. I want to remind you again how important it is to wash your hands thoroughly and frequently. I want to remind you to disinfect hard surfaces because we believe that the COVID-19 virus can survive for hours in certain conditions on hard surfaces. Cover your coughs and sneezes with tissue and discard the tissue. Social distancing is extremely important, and we know the weekend is coming up, and I've had conversations with people outside of Dougherty County in the last few days who say that there are counties in our Southwest Georgia Health District where people are still congregating for church services. And we understand the natural desire to get together and share during times of celebration and during times of sorrow and anxiety. But we need to be creative and find other ways to connect with other people and with other members of our congregation. Face-to-face gatherings are dangerous and they're irresponsible. Please do not get together for social events, including church services, weddings, and funerals, except to follow those guidelines that we have talked about before, no more than 10 people together and always 6 feet apart. Currently, a specimen collection program is going on at the Dougherty County Health Department, and this program is free of charge. It is open to groups of people that include people 65 years of age and older who have fever and respiratory symptoms. It also includes healthcare workers and first responders. People who are interested, who feel that they need to have that test, can accomplish this by calling and making an appointment at the following number, 352-6567. 352-6567. We ask you to please follow the recommendations that you're hearing here today. Follow the guidance of the CDC and the Department of Public Health. Stay safe. Thank you very much.
Thank you, Dr. Ruiz. Barbara Rivera Holmes is here. She is the President and CEO of the Albany Area Chamber of Commerce. We'd like to ask you to come forward for some remarks. Ms. Holmes.
Good afternoon, Barbara Rivera Holmes, President and CEO of the Albany Area Chamber of Commerce. What we're hearing and what we've heard before is the incredible impact that this is taking on our community and on our businesses and on our way of life. We are losing life, and it is something that is absolutely heartbreaking. We're stressing our medical professionals who are doing so much to protect us all. I want to continue to encourage the public and our businesses to follow the order. I remain extremely encouraged and proud of the business community for its leadership and proactivity in so many ways. But we can only do this together. I've been by businesses who are following the order, but the line outside maybe isn't withholding the social distancing of 6 feet within customers. It is so important that every aspect of the order that is in place is followed. The only tool that we have, as we have said every day, to mitigate this disease is social distancing. It is an incredibly hard time, and I'm encouraged by the support that we have all seen. As the chairman said earlier and as the mayor said earlier, we are an incredibly resilient community. We have demonstrated this over and over and over, and we are at it again here, put in the spotlight in an incredible leadership role as we come together as only one Albany to go through this. But what I want to say is that this is not an Albany problem. This is not an Albany situation. And I'm hearing, as so many in this room have said today, of areas where maybe this isn't being taken as seriously. The Albany Area Chamber of Commerce calls on elected officials and business communities outside of Albany and Dougherty County to take stringent action to protect your communities, protect your workforce, protect your economies, because we are in this symbiotic relationship as it relates to our people, as it relates to our workforce, and as it relates to our economies. And this virus does not distinguish between geographical boundaries. It is permeating every part of our life. We continue to call on those businesses and those communities to take the right action, to use Albany as an example, and to put the places in action so that you can mitigate the impact of this. We have seen the impact acutely in Albany. We have seen the arc go from here to here in no time. And there's communities that really right now are in a position to be proactive and to mitigate this. So if you're not in that position, we encourage you to be in that position. If you're a business within this community and you're not following the order, you must follow the order. If you're a citizen and you are not following the order, you must follow the order. I want to again thank the public for the incredible support that they have shown to our medical professionals, to our first responders, to small businesses who are struggling honestly right now through this. This is an incredibly hard time for everyone. The Small Business Administration loans are active for economic disaster. If you are experiencing hardship through this, please utilize this as a resource. The unemployment is also in effect. Please utilize that as a resource. Yesterday, the U.S. Senate voted on a very vast federal aid relief package that hopefully will go through the House, and so some of those will hopefully be forthcoming. There are some immediate tools in place right now that you could utilize. If you're also experiencing hardship through the business community, please contact your financial institution and your bankers. That community of bankers has been extremely proactive in working with their clients and working with them to get through this. So as a business community, I'm very proud of what we're doing. I continue to encourage our regional partners to take action and to not delay taking action, because what is happening in Albany is going to be in your communities. I want to thank the mayor and thank the chairman and all of our COVID task force members and all of our partners through this for the incredible work and support that is being done collaboratively to lead our community through this. Thank you.
Thank you, Ms. Holmes. I'd like to ask to come up for some comments and remarks the Dougherty County School System Superintendent, Mr. Kenneth Dyer.
Good afternoon. Here's some brief updates from the Dougherty County School System. We've had a lot of questions about the restart of school. Today, Governor Kemp issued an executive order that was continue this continuance of in-person instruction through April 24th, with students possibly returning to school on April 27th. Of course, prior to that date, we will evaluate the possibility of the feasibility of that in our community. If it's not safe to return on that date, of course, we will extend that date further. As a result of that executive order, all spring activities, including but not limited to prom, senior activities, athletics events, other extracurricular activities have been postponed indefinitely. No decision has been made pertaining to graduation ceremonies that are scheduled for May 23rd. However, district officials have begun contingency planning in case we cannot have it on the planned date. The district is continuing to provide meal services to our students. Through yesterday, March 25th, DCS's employees have delivered nearly 66,000 meals to the children in the Albany and Dougherty County community. We're pleased to announce that beginning next weekend, we'll also begin weekend delivery services. And we're working with several community outreach partners to begin delivering meals at the dinner hour for our families as well. The district is continuing to distribute digital learning devices for seniors. We began Tuesday at Dougherty High School, yesterday at Monroe High School, today at Westover High School. Next Tuesday, we'll deliver the Chromebooks and hotspots to dual enrollment students who are attending at Albany State and Albany Tech. At present, we have 6 employees and 1 student who have tested positive for COVID-19. We've notified the employees as well as the parents of the students that may have come in direct contact with those employees and that student. And we've advised them to self-quarantine through tomorrow, March 27th, which is the 14th day after the last possible day of contact with the infected individuals. We also advise them regarding what steps to take if they become symptomatic during that 14-day quarantine period. I'd like to remind the public that we're updating our COVID-19 section on our website daily with information that pertains to the Dougherty County School System, as well as information from the CDC and our partners with the Georgia Department of Health. You can see that website at www.docoschools.org. Lastly, a message to our parents and our students. It's important to everyone listening to view this situation as a marathon and not a sprint. We have to work to make the suggestions of the CDC and the Georgia Department of Public Health, the ones such as social distancing, hand washing for 20 seconds, hand sanitizing when soap and water is not available, limiting exposure to sick people, and self-quarantining yourself when you may be ill as a part of our everyday lives. Also, we must abide by the shelter-in-place ordinance in effect in Albany and Dougherty County. Although inconvenient, those restrictions are in place for our health, safety, and well-being. We must slow the spread of this virus, flatten the curve, to prevent overwhelming our local healthcare system, which is not only serving residents of Dougherty County, but our surrounding communities as well. I'd be remiss if I didn't take time to acknowledge the incredible work going on by our local heroes who are going toe-to-toe with COVID-19 and working to save lives. The doctors, nurses, other healthcare professionals, and first responders are risking their own safety by working to slow the progression of this virus in our community. Students, you can be heroes simply by staying home and saving lives. Stay inside. It's really that simple. Young people have a notion that they may not be susceptible to the disease, that their symptoms may be mild, and that may be true. But by going out, you can expose older relatives or loved ones or ones who have underlying health conditions to this disease or this virus and cause them to have critical medical complications or worse. Don't risk losing a loved one because you want to hang out with your friends, period. Adults, let us set the example to our youth by doing the same. So let's move forward together, striving every day to be heroes, to keep our loved ones safe and speed the exit of this awful virus in our community. remember, stay inside and save a life. Thank you for your cooperation. We'll keep you updated with further developments.
Thank you, Mr. Dyer. We will open up now for a few questions. Our speakers are still here in the event that anyone have questions of them. Please, Mr. Dyer.
Yes, ma'am. We're not going to release that information the school, but he is a second grader. Mhm.
Any additional questions? Okay.
I think the pervasive message at this point is, and I think you've heard several people speak to this virus does not discriminate based on age group, ethnicity, or any socioeconomic. We know that people who have, significant underlying medical illnesses, particularly lung disease, people who are what we call immunocompromised, whose immune system is not fully functional due to cancer or any one of a number of things, or people who are quite frail, are at increased risk for becoming severely ill. But I want to reemphasize the fact that this virus is very contagious. It is easily transmissible from person to person, and it's transmissible on surfaces as well. So, fortunately, we know the majority of people who become infected, contract the virus, will have a relatively mild course of illness. And again, we want to reemphasize those groups who are at high risk need to take special precautions, but I don't want to give any false sense of security if you're not in one of the age groups that we see the highest number of cases. It means that you shouldn't be as prudent or take the same degree of precautions, hand washing, social distancing, and that sort of thing, because that's the message we want everyone to hear.
Any additional questions? I want to thank you for carrying our press conference today live. In addition, you can see the press conference daily at 1 p.m. on Facebook Live on both city and county sites. And we encourage you to join us for these press conferences as we bring forward vital and important information to our community. At this point, we will end for today, and we'll see you tomorrow at 1 p.m. Thank you and have a great day.